15 minutes or less, hopefully less, so that we have time for questions at the end. So I'll turn it on over to Grace. Thanks.
Hi, everyone. Good afternoon. Let me get my screen set up.
A quick reminder, if you guys feel like putting your camera on, we love it. I know it's much more fun to present when you can see other faces. So just a small nudge. If you can't, chaos is happening in the background, A-okay to not.
Okay, can everyone see my slides?
Yes.
Perfect. So hi, everyone. My name's Grace Sparks. I'm a survey analyst at KFF. Excited to be presenting today. I'm going to be talking about the impact of COVID-19 on the LGBT community. So first, I wanted to introduce KFF, who we are, what we do. KFF has been working on some of the most pressing health issues facing us for 25 years. During the pandemic, we pivoted to COVID, since that was the most pressing healthcare issue at the time. But in late 2020, it became apparent that there would be an ongoing need for a survey that would measure the dynamic of vaccines in the US. So we launched the COVID-19 Vaccine Monitor to keep track of people's vaccination status, attitudes, and lots more. We're also looking monthly at news not directly related to vaccines, such as financial and mental health impacts. All of this are part of our monthly poll. It's been a wonderful and extensive project that I really hope has helped the survey and helped Worlds in its information. We do try to focus on understanding some underrepresented populations, which I think has been the goal of our deeper dives into the Black and Hispanic communities, oversamples of parents, those who live in rural areas, and today looking at the LGBT community. Past LGBT polling has not been particularly extensive, with few and far between surveys that entirely focus on this group. But in the last 20 years or so, survey research has started to expand to ask about LGBT identity. It's developed in its way of asking, and generally just increased in the research that we have. In particular, GSS, the GSS and Gallup have started asking LGBT identity, which has really encouraged others to add it to their surveys. In order to talk about LGBT identity, KFF has worked on examining how the polling world asks about sexual orientation and gender. In 2020, we added a third option to our question on gender and changed the options to be more consistent with gender, and with gender instead of assigned sex. We also started asking our LGBT question on every survey. You know, what we'd really like to see are more studies that are designed to look at this specific population, but they're pretty hard to conduct, they're difficult to weight, and they do cost a lot of money. So that would be the gold standard, but our goal here is to have these questions so that we can pull something out and have some information rather than none. For each survey, we're probably getting around 100 and sometimes fewer LGBT respondents. For some months, we have combined the samples so that we can talk more extensively about demographic breakdowns of LGBT people, especially as it relates to COVID, and all those places are denoted as such. These are our N sizes for the months discussed, in case people are interested. All right, let's get to the data. So one of our first interesting findings about the LGBT community is the impact the pandemic has had on their mental health. Across groups, we are finding around 4 in 10 total adults who say that the pandemic has had a negative impact on their mental health. But that number is significantly higher among LGBT individuals. In December 2020, before vaccines were introduced to the public, almost 3/4 of LGBT adults said the worry or stress related to the coronavirus were having a negative impact on their mental health. That number did dip across the board, including among LGBT people during our July survey, with reports on mental health improving. July was pre-Delta's impact when the mask mandates were being lifted and lots more urban areas were beginning to reopen. As well, there was a shift in federal messaging in July that made a lot of people feel safer. That was rolled back, and with Delta, the guidance has been to close back down. So since then, in our recent October data, the number who have said they've had a negative impact to their mental health is back up to around 7 in 10 LGBT people and 4 in 10 non-LGBT people. For some context, LGBT people in general do have higher rates of mental health issues and substance use disorders, so there is likely an influence from the pandemic on something that already existed in that community. In our recent October data, 82% of LGBT people reported receiving at least one dose of the COVID-19 vaccine, compared to 71% of non-LGBT adults. These numbers have been consistent in their gap since young adults were able to get vaccinated this past spring. Of course, LGBT adults do tend to be within groups that are more highly vaccinated, especially looking at Democrats. They also, interestingly, tend to be younger than non-LGBT adults, but younger adults tend to lag in vaccination rates behind those under 50. So that's sort of an interesting phenomenon. Interestingly, so my colleague Audrey was kind enough to run a multivariate analysis for this phenomenon, a statistical model that separates out the influence of these different factors. The findings indicate that being LGBT is a significant indicator predicting vaccine uptake, with reporting LGBT adults having a positive effect on the likelihood of being vaccinated. The regression controls for other demographic factors seen on the slide and holds constant based on the average population. And it indicates basically that LGBT people are about 6 percentage points more likely to be vaccinated than non-LGBT people. So of course, demographics aren't the only thing that predicts vaccine uptake. Mindset on vaccines also plays a huge role, or possibly the other way around. 2/3 of LGBT people say that getting vaccinated is part of everyone's responsibility to protect the health of others, while non-LGBT people are more split, with 55% who say it's a personal choice. And all of this is from our recent October survey data. Another attitudinal predictor of vaccination status is how concerned you are with getting seriously ill from COVID. Around half of LGBT people are worried that they personally will get seriously sick from coronavirus, while almost 3/4 are worried that a family member will get seriously ill. Significantly fewer non-LGBT adults feel the same. LGBT adults are more likely to work in highly impacted fields by the coronavirus, which could possibly, sort of raise their level of concern of sickness. From a public health perspective, while seeing the pandemic differently does tend to trend with party identification, LGBT people could also see it differently due to a prior experience with HIV/AIDS crisis and the public health approach from the community being a little bit more ingrained in their experiences. So in our biggest sample measured, where we combined our months of April and May data, we did find that unvaccinated LGBT people tended to be lower income, have lower levels of education, and be uninsured, which are all variables that are generally related to lower levels of vaccination overall. This was earlier in vaccination efforts when vaccine uptake was lower to begin with, but among the general population, we have found that income, education, and health insurance status continue to predict vaccination uptake among the general population. Also in this spring, unvaccinated LGBT adults voiced similar concerns to vaccines to what we saw in the general population, with half of unvaccinated LGBT adults worried they might need to miss work due to side effects from the vaccine, and 1/3 who were concerned about out-of-pocket costs. keeping in mind that the group was lower income to begin with. Okay, so I'm wrapping up. I wanted to say thank you for watching, let you know where to find us. We're publishing almost monthly polling data with semi-regular LGBT reports on our questions when we have big enough samples to break out. I wanted to thank PAPOR for hosting this today. AAPOR has been such a wonderful organization, a great place for all of us to gather, share methods and best practices. So greatly appreciated that. 2 plugs today. One is for our dashboard, which has a lot of the KFF vaccine monitor charts in one location. I recommend it because you can go from there and sort of find what you need. The other is if you enjoyed this presentation and you would like to learn more about our COVID-19 vaccine monitor and KFF's work in general, you should definitely attend my colleague Ashley Kurtzinger's plenary this afternoon. She'll give you a chance to dive more deeply into our findings over the last year. So thank you very much.
Perfect. Thanks, Grace. That was great timing. I'm going to move on over to Gina now and let Gina from leanin.org speak next.
Great. Thank you so much. Let me get set up here too. All right. Everyone can see me and hear. All right. Welcome to the Promises and Realities of Diversity, Equity, and Inclusion, or DEI, in corporate America. My name is Gina Cardazone. I work for leanin.org as a principal researcher, and I am a co-author on the Women in the Workplace report, which I'm going to draw from heavily during this presentation. A little bit about the Women in the Workplace report. This is the 7th year of leanin.org and McKinsey's report. It's the largest study of women in corporate America, and this year had more than 400 companies participating, employing more than 12 million people, and including some very huge names out there like Google and Target. A subset of the companies that participated in the larger study also participated in an employee survey. So 65,000 employees responded in that employee survey. Looking at things from both the company and the employee perspective, I think really gives us a unique view into discrepancies, particularly between what companies think is happening, what employees think is happening, and how to get closer and close that gap. So in June 2020, as we know, many companies promised to take action against racism. And to some of our surprise, companies actually did seem to do this. Actions ranged from minor to seemingly substantial. And people were excited about the energy around this, but wondered whether it would last. In last year's report, in this report, we noted that 93% of companies self-reported making commitments to increase focus on racial equity. But last year, one interviewee said they put out a statement, they've started having difficult conversations they probably should have had a long time ago. I'm happy with the response, but ask me a year from now if I'm still happy. So we asked them. And we found that companies did take action to support racial equity and DEI, sometimes quite a lot of action, but perceptions differed. So what do employees think of their company's follow through? The majority say that their company did follow through on commitments to racial equity, at least a moderate amount. But responses differed by role and race. Senior leaders were the most likely to say this, while white employees were more likely than Black, Latinx, or East Asian employees to say this. As you can see, the biggest discrepancy is between white employees and Black employees. This is somewhat reminiscent of past Women in the Workplace reports where we've asked companies how they're doing on sexism, and men think we're doing great, and women are not so sure about it. What did employees see their companies doing about DEI? Some of the more visible things were things like senior leaders speaking about the importance of DEI, all employees receiving training and anti-bias or promoting DEI, and companies investing resources or supporting employee resource groups. Fewer employees said that their company did things like holding managers and senior leaders accountable or taking concrete steps such as changing hiring practices. And when asked whether they took training, they confirmed this, saying that like larger percentages of people who have taken anti-racism or anti-bias training in the last year than in the previous year. It's not the same exact sample, but since we deal with such a large sample, we think that, a jump from 25% to 55% is quite a meaningful jump. This is the first year that we asked about allyship training, and it's not quite as common as some of the other trainings, but we believe it's important to have training that's anti-bias or anti-racist, but also promoting positive behaviors. So companies don't quite agree with employees. While employees were not too likely to say that companies were holding managers or senior leaders accountable or taking concrete steps, the majority of companies did say that they held their senior leaders, particularly, not so much managers, but their senior leaders accountable, though this accountability could be something as simple as sharing diversity results within the organization, and is less likely to be something like penalizing them on their performance reviews or changing compensation. So what accounts for the difference in perception between employees and companies? It could be a lot of things. It could be that companies are not communicating their changes widely. So maybe they are doing the right things, but people don't know that they are. And it could be that some of these things are happening, but they are not happening at every level. So we do see that there seems to be more of an emphasis on senior leaders and making sure that there's adequate representation in senior leadership, but not as much in the lower rungs, which is actually really crucial for later career development and for having senior leaders in the future that represent people diversely. So we asked company leaders themselves, what has been most crucial to your success? What accounts for any effectiveness in your diversity, equity, and inclusion activities? And there are a lot of responses, but major themes included having senior leaders that supported and sponsored any kind of DEI efforts and having employees that were engaged. And a lot of companies pointed to things like employee resource groups or employee-led events that were really important, they felt, for transforming their culture. This brings us to the issue of invisible labor. So this work is important, it's valued, but it's not necessarily rewarded. And this is a problem. So 70% of companies said that employee work that they to support DEI, including that's outside of their formal job responsibilities, is crucial to companies achieving their DEI goals. But less than a quarter said that they actually formally recognize that work or that it's criteria used in advancement or compensation decisions. And even fewer employees said that. This leads to a discrepancy in who's actually doing the DEI work. So since this isn't usually involved in more compensation or career advancement or recognition, only the most intrinsically motivated people are doing this work. And it tends to be more women leaders than men leaders, and particularly women leaders with traditionally marginalized identities, especially Black women, LGBTQ+ women, and women with disabilities, who are up to twice as likely as women leaders overall to spend a substantial time on DEI work outside formal job responsibilities. And this can lead to burnout and frustration. So one VP said, "We've been told that our DEI work is beyond our day jobs. It's frustrating. We're working on DEI after hours, in the evenings, on weekends, and on vacation. And there's no formal recognition of our effort." And recognition is crucial not only to help people feel better about it, but also to encourage all employees to participate in these kinds of things and see it as part of their work for the company and not just something they do it on the side. Women, even women without children, are more burned out this year than men by a long margin. And part of it could be the additional work that women are doing to support companies with what we're hoping won't become the new office housework, work that's really crucial to companies succeeding, but that isn't recognized or rewarded. It almost goes without saying, huge problems persist and we need sustained action. The energy of last year needs to last for the next 5 or 10 or 100 years. The representation of women, especially women of color, in higher levels of leadership is still incredibly low, and change is needed now at those lower rungs in order to make sure that we can increase representation at higher rungs. Women who are women experience microaggressions at higher rates, especially women of color. And because of that lack of representation, a lot of times women are the only person of their gender or the only person of their race in a room, especially as they go into higher levels. And women who are onlys, especially women who are double onlys, meaning that they're only women and they're the only person of their race in a room much of the time, or in a Zoom meeting, experience even more microaggressions, especially othering and disrespectful behaviors, such as overhearing insults about your culture or people like you, or feeling like you're expected to speak on behalf of all people with your same identity. And people are, speaking up about this. Black women are more likely than others to speak up about it, but they're also more likely to suffer consequences because of it. So among people who've spoken up against bias and discrimination, Black women are about 4 times as likely as white men to have experienced retaliation because of it. That's why it's really crucial that people show up as allies. So even those who are not affected directly by discrimination need to take a part in making companies more committed to DEI. And nearly 80% of white employees said they consider themselves allies to women of color at work, but fewer of them are doing things like actively confronting discrimination or advocating for new opportunities for women of color. There are company actions that appear to be making a difference, and this is correlational, but I think it's pretty powerful. We looked at companies that have seen real progress in increasing diversity in leadership over the last few years. And compared to other companies, they're more likely to do things like de-bias hiring and performance review processes, track diversity metrics, especially intersectional metrics. So it's not enough just to track representation of people by gender and representation of people by race, ethnicity. You have to look at the intersection, such as looking at women of color. You have to hold senior leaders accountable in a meaningful way. Companies that are leading the way are doing this in real ways that translate to changes to performance reviews, changes to compensation. These companies are more likely to offer allyship or anti-racism training to all employees, to provide mentoring and sponsorship programs, to provide supports like paid family leave and childcare, and to support employee resource groups. And I'll leave off with a quote. This work takes time. There's no one way to solve diversity and inclusion. Leadership must be early adopters, and DEI must be ingrained in a company's culture and values. Additionally, DEI learning should be a journey, ongoing and continuous. It's important to make sure employees get comfortable with being uncomfortable. For more information, I'll do our plugs is women. You can look at the Women in the Workplace report. We also had a report last year called The State of Black Women in Corporate America that consolidated data from past reports and also from external research. And we've recently launched an allyship program that's free to all companies and has gotten some really positive early feedback. I can attest as someone who works for the organization that it was done in a very intentional way, really looking at intersectionality, and I really respect how it came about. So if you're looking for an allyship program, we've got one. Thank you.
Perfect. Thanks, Gina. That was a lot of great information and a large study. We have one last person coming on up. It's Melissa Moore. I'll go ahead and give her the time, and then feel free to start putting your questions in the Q&A, and I'll lead that discussion in a little bit. Until then, I'll turn it on over to Melissa. Thank you.
Excellent. Thank you very much. I'm excited to be here. Let me just share my screen. All right. So my name is Dr. Melissa Moore. I am currently a project manager at YouGov, but today I will be representing research that I conducted with my colleagues at the University of Buffalo regarding the framing of inspirational content in news media. So a bit of background on what inspired this research and where we're coming from here. I'm sure all of you have seen a story like this. It's an inspirational news article, and it's meant to be really heartwarming and uplifting because there's some sort of good deed taking place that's solving a really tough problem. Maybe it's a community that's coming together and giving somebody a car. Maybe it's a child helping an adult, or maybe it's a child raising money for their own healthcare, like in some of these examples. The tough thing about them, though, is that these articles usually omit the context that led people to be suffering and dealing with these problems in the first place. And when my colleagues and I noticed this, we decided we wanted to investigate whether this framing of these terrible situations as uplifting might be shaping audiences' perceptions of responsibility for those issues and their willingness to help and engage with this type of subject. Now, usually when researchers look at framing, they're comparing episodic to thematic framing. Episodic focuses on individual experiences. It's a single occurrence of a story, and it usually promotes responsibility at an individual level, whereas thematic framing looks more broadly at a situation and as a result tends to promote a larger sense of responsibility, maybe at a governmental or societal level. We're also considering, when we look at how audiences are responding to news stories, to what we refer to as narrative effects. Specifically, how engaging with a narrative affects emotions and, in this situation, willingness to engage with pro-social behaviors. The major mechanism that we're looking at here is transportation, which is cognitive and emotional immersion into a story. This is that feeling you get when you're reading or watching a movie and you don't realize that somebody's calling your name or trying to get your attention. This mechanism can increase persuasion, lead to stronger belief, attitude, and behavior changes, and can motivate pro-social action, especially when there are strong emotions involved, like awe or gratitude. We also differentiate here between enjoyment and appreciation, with enjoyment being a purely pleasurable experience and appreciation being more associated with thoughtful and meaningful experience. So in addressing this issue and exploring differences in news framing, we took a single episodic story that focuses on one of these individual cases of giving and manipulated whether or not we called out the broader thematic context. So we kept that episodic focus, but incorporated thematic elements to see if pointing to a broader need for change would have any differences. And the story that we used came from actual news coverage based on a teen boy who saved at his after-school job for 2 years to buy an electric wheelchair for his friend. And we took this story and created 2 different versions. The inspirational version, by the way, this was all anonymized, including the author's name. The inspirational version stays really close to that initial coverage. It focuses on the good deed between friends. We have quotes from the characters who are actual people saying that he wanted to do his friend a favor, basically out of the goodness of his heart. In our manipulated social issue version, we changed those quotes and other elements of the news piece to call out the broader context. So in this example, you can see that the giver is motivated by the fact that wheelchair wasn't going to be covered by insurance, and that there are other people who have this sort of need. We were interested in, first, attributions of responsibility. So who would readers see as responsible for solving this? Individuals, insurance, government. How willing would they be to help in this situation, and what type of help? An individual type, so donating or volunteering for that specific person, or a broader social help like advocating and signing petitions. We wanted to see how their judgments of wheelchair recipient were affected, how needful he seemed to be in the situation, how fair the situation was perceived, and how likable he was. Their narrative engagement, again, looking at transportation, enjoyment, and appreciation, and how willing they were to share with this material with others and read similar stories in the future. For our design, we created 3 conditions. So they read either version of the story or a no story control. Were randomly assigned between these and then completed questionnaires. The sample was recruited from MTurk, so of course it's not representative, but participants were paid for their time, and we checked that demographic and other characteristics were balanced between conditions. Of note, unfortunately, due to a programming error, the responsibility items were only shown to our second round of data collection. So again, based on the concepts I introduced here, we expected that the inspirational story would promote a greater sense of individual responsibility, more individual types of help, and that people would see that type of help as more effective. Whereas we expected the social issue story to promote a broader sense of responsibility between insurance or government, more broad means of helping, and that people would see that type of help as more effective. For research questions, we examined how these different framings would affect people's intentions to engage with help, their narrative engagement, desire to read and share similar stories, and again, perceptions of the wheelchair recipient. So what did we find? First of note, our population was mostly male, Democratic, and white, which tracks pretty well with the average MTurk population. But again, these were distributed equally between conditions. Now, in terms of responsibility, we did not see any significant differences between insurance and government in any of the conditions, but we did see that people who read our what was close to the original, the inspirational version, were more likely to see that individual as responsible for solving his own problem, which is really big, really huge, that a simple news story like this can shape our perceptions of a person in need, to think that the onus is on them more than other structures that are maybe associated more with this type of help. In terms of social oriented helping, either population who read either story, both were more likely to engage in or want to engage in individual means of help, again, like donating or volunteering, as compared to the condition who didn't read a story at all. But only the social issue version increased the broader level of help as compared to control. So again, advocating or signing petitions that would help a larger population. In terms of perceptions of the wheelchair recipient, both conditions thought he was equally likable, but the social issue readers saw his need as greater and perceived his situation as less fair. So again, just really small changes in the framing, greatly affecting our perceptions of how much this person is in need, how responsible they are, and how fair we think the situation is. In terms of our narrative engagement elements, appreciation was equal, but those who read the social issue frame did slightly, significantly, but did enjoy the piece a little bit less. But both readers were equally transported and immersed into the story and likely to want to read or share similar material in the future. So overall, we found that, as we expected, this type of framing can greatly shape our perceptions of these issues of social need by making us see a situation as more or less fair, changing who we think is responsible for solving the problem, and affecting how willing we are to engage in different types of help. It's our hope that people who create this type of content, and journalists in particular, will not hesitate now to call out the larger societal issues at play. It might mean the readers enjoy the reading a bit less, but they're just as equally engaged and likely to share the information. So readership wouldn't be effective. And we hope to look in more detail at calls to action in the future. One of my co-authors pulled out this quote from Pope Francis that really connects to the heart of our research here, which, yes, it's great that these individual stories can increase our desire to help a single person, but it's a much greater act of charity to call out the situation as a whole and affect the many other people who are suffering in similar ways and create a solution that would help at a broader level. So a huge thank you to all of my co-authors who made this possible. This full article is available on open access through Media and Communication. And thank you again all for being here. I look forward to your questions and I hope you enjoy the rest of the conference.
Great, thank you. So I'm just gonna go ahead and now just open it up for any questions. If we don't see any, I'm going to start asking some myself. Okay, this is one for each of you. If there was one thing that the people you're talking to today, the researchers who are conducting this or working in corporate America, could do to help with diversity and inclusion, what would be the one thing that you would recommend us to do?
I would say,
Go ahead. You guys can take turns, and who would like to speak?
sure. I don't want to assume, but I think that the other speakers would agree that language matters, that the way that you represent these issues, even very small changes in your wording, can really affect how people engage with the issue. So framing it as any individual in need as putting the onus on them, or expecting, as a previous speaker said, expecting women to maybe take more of the burden, especially intersectional women. The framing that the wording and language that you use when communicating this stuff to staff or to other audiences needs great care. And it would probably be helpful to engage when you're crafting those messages with somebody in that affected population.
Great.
Yeah, definitely
Go ahead.
seconding that. Sorry, engaging with the population, I think, is really key. It's definitely something we've seen in our own research, and just sort of asking questions and making sure to understand the group. I mean, just coming from a polling background, I find that having an overall picture, talking about the LGBT population, you can look at them and say, oh, well, they're just all Democrats, but they're also young and lower income, and there's a lot of sort of nuances there. So I think really taking the time to get an understanding of the group is important.
I like to echo that. I struggle with just the one thing because there's many things, but I think it does come down to listening to and engaging the people most affected, while at the same time not leaving them solely responsible for fixing their own problem. It's kind of a tie between, tie-in between what Melissa presented about and what our report says, that that attribution of responsibility matters, and everyone should feel responsible. In my case, for promoting diversity, equity, and inclusion in companies, but in general for addressing social issues, and not leave it just to the people who are most affected.
Perfect. Well, I don't see any other questions, so I'm going to have another question for all of you. If there was one thing that was the most surprising to you in your research, what would it be?
I didn't include this in my presentation, but the fact that these beliefs and the effects that we saw in terms of how framing shaped people's agreement and attributions, that held regardless of political identification. So it wasn't just that more liberal people were more likely to want to engage in helping or more affected by the messaging. It held across political party identification.
That's really good, because it can then apply to a lot of different media people, right? It's not just one audience who wants it. It's a good framing for everyone.
Yeah, actually, I was going to say a very similar thing for ours, which is this multivariate analysis, which is that, I think we were most surprised to find that LGBT people are not more highly vaccinated just because they're Democrats. That does hold steady when you control for all of those extra factors, gender, age, race, party, ideology, all of that, that it still comes out as a significant predictor for vaccine uptake, which is I wasn't necessarily expecting. So.
I think there's a lot more to the Women in the Workplace report than what I presented. So again, it's just hard to pick what's most surprising. Some of these things we expected, some of them we didn't. I think I was surprised that such a large proportion of companies did make promises and that some actual change was affected. Maybe that's a cynical thing to say, but like, obviously a lot more needs to be done, and 57% of employees saying like, yes, my company followed through may not sound stunning, but I think if it was like 20%, I wouldn't have been that surprised. Another thing that I didn't report on here, but we did do multivariate regression analysis looking at predictors of burnout, and did find that, recognizing employee work, both for DEI and for supporting the emotional well-being of employees, did predict burnout and propensity to leave, even when accounting for other factors. So that was kind of, I think that's significant. And I think it's complex what's behind that, but I was surprised to find that.
Great. As a side question, did you see responses of companies who said that, hey, this is all just siloed under an HR banner, or is it, this is really every company and every manager has to do this? Did you see that type of difference with different companies? And if so, what came out of that?
That's a good question. We have a lot of questions for companies, and I think that comes out actually more in the employee survey than in the company survey, or the data that the company brings. The company thinks that the company's doing everything right, but the employees are the ones who will say, like, yeah, they talk about this, but it's just lip service, or and I think for next year in particular, we want to dig a little bit more into sort of the experiences of people who work in DEI, whether they, we did ask a couple of questions. We didn't share it in the report, but we did ask questions about whether they think that they're getting sufficient resources to do their work. And I think that also really makes an impact on burnout, but also on whether the company's, making progress. Like, is DEI a little part of what a couple people do, or is it embedded in everything? I think we can see it in some things like training being mandatory for everybody, or offered to everybody, instead of, just a few people in management. But that's a good question. And if you have ideas for how to get at that, I'm developing next year's Women in the Workplace survey right now. So
Perfect. Okay. Well, I didn't see any other questions in the chat, so I don't know if I'm missing them or anything else, but I'd like to thank our panelists, and I think we'll go ahead and end it right there. Thank you, everyone.
Thank you so much for presenting. That was an excellent panel. I encourage everybody to ask further questions when you think of them as you're finishing your lunch. I'm sure they'll come to mind. Drop